A life-saving drug that's been around for decades is now in short supply and could put the health of thousands of people at risk.
We're talking about insulin, a drug that just a few months ago was almost unaffordable until the president signed the Inflation Reduction Act, which did bring down the cost. So what's behind the shortage now? NBC2's Dave Elias investigates.
Well, to give you an idea just how much the price of insulin has dropped recently, back in December, you could get this box of insulin pens for just about $600. Now, you can pick it up for about $160 if you can find it.
This is an imperative medication. It's not just optional.
Dr. Suhook is talking about insulin. She says about 20% of her 9,000 patients depend on it.
So if a person is unable to get their insulin, their blood sugar is going to go up, 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 and then we start seeing the uncontrolled diabetes side effects.
Insulin has been in use since the early 1920s, but lately in short supply.
When you're talking about regular insulin and 70-30 mix and things like that people can't get, that have been around forever, something's wrong.
Eli Lilly, a huge supplier, warned there would be a shortage in April because of delay in production. Pharmacist at the Fort Myers prescription shop, Rich Lawrence, is seeing it firsthand.
Some of them have been very difficult to get. Just before you came, I just double checked, and there's a whole bunch of them that are either very, very low stock or not in stock and expected not for a couple of weeks.
Impacting many of his patients who rely on it.
Have you had some patients that have come in and had to just wait until you could get it? Or
Unfortunately, yes, or I've had to contact the doctor and work on changing them to a different insulin that is available.
Eli Lilly also says those who need insulin immediately and can't access it should seek emergency care. Lee Health confirming today that they are not impacted by the shortage.
At the end of the day, it's economics 101. It's supply and demand. And right now, the demand is much higher than the supply.
Some scientists, though, predict millions of people worldwide may be unable to access insulin by 2030 unless access to the drug improves significantly.
It's surprising and shocking.
Now, the best advice, if you have insulin that you've got to pick up at the pharmacy, you may want to call ahead to make sure they have it in stock or can get it. In Fort Myers, Dave Elias, NBC2.